and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course.
That would have been
Bob.
one for our bloopers, Brad. But
Yeah.
we just screwed up. Okay, today, Brad, we're going to talk about the 10 ways to stretch your hip and stop pain. We got contacted by a high-level athlete, Brad. Professional athlete, and he's having some trouble with hip pain, even maybe a little arthritis, even though he's young. So these are the basic ones I want you to try first. And then we're going to show another video where we have advanced hip techniques.
Sure.
So the one thing you might try when you have pain or arthritis, now we aren't pharmacists and we aren't doctors, but this is a suggestion that some of our patients get from their doctor or from their pharmacist, is that you may try a short period of ibuprofen.
3 days.
Right, 3 days, just 3 days of ibuprofen.
So you're going to take your certain amount, and actually the higher amount is what we're going to go for, and you could go as high as 400 to 600 milligrams.
Right, each pill is usually 200 milligrams.
Right.
So a lot of times what they'll say, like the pharmacist says, you might go a higher dose, maybe like 400 to even 800
Sure.
on some people.
Yep.
You're going to want to get this approved by your doctor.
Right.
But this is a high dosage of anti-inflammatory, and you can do this for the 3 days, and then you stop.
Yeah, so it's 3 times a day for 3 days. Make sure you get something to eat when you do this.
Because like toast or something like that.
Right,
Because
milk, toast, whatever.
It'll be hard on your stomach.
Right.
And again, get this approved by your doctor, but I would recommend not only doing it now, because arthritis tends to flare up and calm down, but I'd also do it right before any big athletic event. Like let's say, if you're going to have the Super Bowl, I would do it 3 days before the Super Bowl.
Sure. So you're getting rid of the inflammation, the pain, so you're ready to go for the activity or
By the way, if you're new to our channel, please take a minute just to subscribe. We got our subscribe button over here on the screen. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Let's start off, Brad. Number one. The first one is hip flexion, and you can do this laying down on your back. And we're doing a little bit of what we call the McKenzie technique here, because there are a lot of people know the static stretch here, but he also recommends the pressure on, pressure off stretch.
Sure. Yep.
So I'm stretching my hip into flexion. I'm going to go pressure on, pressure off.
There you go.
Pressure on, pressure off.
And about that rhythm.
Yeah.
Okay.
About that length of time. The reason you say pressure on, that tells you how long to hold it.
Yeah.
Pressure on, pressure off. And if you find out one hip is tighter than the other, that's the one you're probably going to want to focus on, Brad.
Sure.
Don't go into anything that's as you were saying, sharp pain.
Right. If you do this pressure on and you get pain, and then the second time it's still painful, and it's getting worse each time, you need to stop.
Yeah, you want to back off. But if it's getting better, then you can go ahead and push it harder.
Yeah, the first time, say the pain's at a 7 or 8 over 10, and by the 10th one, it's down to a 2 or a 1, you know you're doing something right.
I'm going to show you a couple other ways to do this one, Brad. You could be kneeling on the floor here, not on a table like this, but you can actually just go ahead and go like this. You can really get into this then.
Yeah, really stretching that hip.
Again, pressure on, pressure off. Pressure on, pressure off. With arthritis, what we have found, and with a lot of hip problems, Brad, the more you regain motion, every little degree of motion that you gain, it actually helps decrease the pain.
Sure.
So another way to do hip flexion, Brad. You were going to say something?
Yeah, but I'll mention it in a little bit.
Okay. Is on a chair. So same thing again. I can really lean. Look at how much I'm really leaning into flexion.
Get that knee right up.
Yeah.
Now,
pressure on,
if you're a little
off.
older, some of these you're not going to be able to do, and if you're not able to because it's not safe like that because you feel like you're going to fall, you go to the next one.
Yeah, do the one where you're laying on the bed then, the safe one.
You're going to go through all 10 of these, and there may only be 2 or 3 that seem to help and relieve the pressure or where the tightness is and you want to get it. So you're not going to do all of these all the time.
Right, and this is
Pick them out.
This is a more difficult one, Brad, but this is one that is often lacking in people, is the hip internal rotation.
Oh, sure.
So you put your foot up like this, and you're actually going to bend your foot down like this, your knee down like this, because you're turning your hip in.
What that's doing, it's rotating the femur, which stretches out muscle, and what we call the posterior aspect of the hip.
Pressure in, pressure on, pressure off. Pressure on, pressure off. Pressure on, pressure off.
Now, use good judgment. Obviously, you're not going to push so hard you dislocate your knee or your hip.
Right.
It should be a stretch.
But you can tell, when I'm sitting here, Brad, if I go like this and one goes this far and one goes that far, this one's tight.
Right.
So that's what we're stretching there. Next one, Brad, we're going to do actually what we call hip extension, getting the hip back like this. And one way to do that is to actually do press-ups.
Sure.
So you're actually stretching your back a little bit too, but you're stretching the hip.
And if you look at it, here's the hip and he's coming up here. So we're getting an extension, what we call extension stretch in the hip, getting the muscles
So again,
here
pressure
stretched.
on, pressure off. Pressure on, pressure off. Now, one other way of doing this, Brad, is actually to go off a bench like this, and now you're going to get just doing one.
Right.
And you can get a little more intense this way, Brad, because now I'm like this, and now I can go like this, and now I can really stretch that hip into extension.
So you cannot see it from this side, but this is the hip over here. The one that you can't see is the one that's getting the stretch, although he is doing a little stretch here, but over here where you can't see it.
Pressure on, pressure off. Pressure on, pressure off. Really good. Well, I guess if I do it this way, it's going to be the same thing, isn't it, Brad?
You'd have to go on the other side of the table.
Difficult to see. So,
And a lot of times, I think, and I've had success, usually one direction or the other will help. Oftentimes not both, but you're going to have to just see how it goes.
you want to throw me a pillow real quick, Brad? So this is the other hip extension stretch that a lot of people do, is this one here where they go like this.
Yep.
And the big thing you want to remember with this, Brad, is not do this, right?
Exactly.
You're going to go like this and pressure on, pressure off. This is the one I do, Brad.
Sure. Yeah.
Every morning.
This is a common one for runners and athletes, where you're getting the extension is right here. That's why if you lean forward, you're not going to get the same stretch.
Same thing with all these. You're not looking for sharp pain. You are looking that, sometimes after doing it a while, the pain actually starts to come down.
Right.
So,
or when you're done and you walk away, say, boy, that really feels good now. Or as opposed to if you get done with it and it starts to tighten up and it gets really painful, that's not good.
okay, now we're going to do a figure 4 stretch. This is for external rotation, Brad. If you find out, like when you're sitting on a chair and you go like this, and this knee goes all the way down, then you go like this, and this knee goes up like that.
Right.
This one's tight.
Sure, right.
So, and mine is a little bit tighter on this side than
I am that way too.
this side. See that? The difference?
When I put my socks on in the morning, I actually give a little stretch every day just so I can maintain that hip movement.
And that's one way you could do it. You could actually just do it right like this, Brad.
Sure.
Pressure on, pressure off. I do it a lot of times what we call the figure 4.
Yep.
Because we're making a 4 with it. You can go like this, and you can even go up like this and pressure on, pressure
Sure,
off.
yep.
Or I even go like this sometimes, pressure on,
Right.
pressure off.
Right.
So a lot of different ways you can do it.
One thing I wouldn't recommend though, Bob.
What's that?
You just have to sit, I got to sit down. If you're going like this and you're doing that pressure on, don't have your wife sit on your knee and do it. It's not going to work good. I just
That's
had
not
to
the-
throw something in there, Bob.
I really hope that you don't, any more ideas like that don't come in your head. Okay, Brad, let's talk about hip adductor stretch. Do you want to show this one?
Sure.
Okay, can you show this one on the
Yep.
floor? The pillow, you'll need to kneel on it, right?
Oh, yeah, I was thinking the one you do on the table.
Well, you can show that one too.
Okay. Let's see, let's go this way. The hip abductor.
Adductor. So you're going to do this out like this. And remember, you're going to go straight,
Oh, that's
45 and upwards.
Yep.
So
So we're stretching the groin. Okay.
Yeah. So you can first start by stretching here, and then you can even go a little pressure on,
Yep.
pressure off.
So I'm going like this a little bit, and we can put some rotation.
Yep.
And this is going to be different for everyone.
Yeah.
I can rotate really easily because that's when my hips are. Some people won't get that high.
Yeah, your hips turn out naturally anyway.
Right, yeah, I've got
So-
that natural advantage.
So,
Oh, I don't know if it's an advantage or not.
you want to show the one up here then too, Brad?
Yeah. I do like this one.
Again, same thing. You can go pressure on, pressure off.
These are, by the way, if you're in martial arts and you're kicking, these are really good stretches to get your kicks higher, whether it's a front kick, side kick, or round kick. There we go. So right now, as I bend this knee, that puts more pressure on the hip and abducts it a little bit more. And you can't get the rotation with this, Bob, like the one we just showed there.
Right.
Right.
Well, again, now these are basic stretches. These are not the advanced ones. That'll be on another video. I'll put it up in a couple days. But try these out first and see how things go. If you don't have any improvement with this, try the advanced ones, which you may need some help with doing those.
Right. Okay.
Remember, we can fix just about anything.
Except for that,
Broken heart.
Oh, it's coming right up
Yeah,
here.
it's coming up here.
Yep.
Thanks for watching.
Nice heart, Bob.